Welcome back to Proof or Potion, the podcast where we take a skeptical but curious look at natural health remedies and we're just going with it, and dig into the actual science behind the claims. Today, I get to share, and I'm really excited because I'm diving into a study about a potential new treatment for veterans with combat-related PTSD. The article was published in the Journal of Clinical Psychiatry in October of 2024 and is titled Hyperbaric Oxygen Therapy for Veterans with Combat-Associated Posttraumatic Stress Disorder, a randomized, sham-controlled clinical trial. So it is totally a mouthful. So just a quick look at what HBOT is. It's a hard-sided pod where 100% oxygen is pumped into the pod, and then it's brought up to pressure with the participant inside. So this has been studied for several different things, but this is the first, I think, study that I've seen on like a mental health condition. So let's get into the basics of this study. So first of all, this was a randomized sham-controlled trial, meaning that they compared a real treatment group to a placebo-like group to reduce bias. The study was done in Israel from 2023, and they focused on male veterans aged 25 to 60 with combat-associated PTSD, specifically those who had not improved on the standard treatments of therapy and medication. So to evaluate these participants, they used the CAPS-5 scale, which is just a standard PTSD assessment, which confirms severe symptoms. So how did it work? So 35 veterans were split into groups of 2. The experimental group received daily 90-minute hyperbaric oxygen sessions for a total of 60 days. During their sessions, they were given 100% oxygen under 2 atmospheres of pressure with little short air breaks to prevent oxygen toxicity. The sham group also went into the HBOT machine, but they got room air at normal pressure. The researchers then measured the participants' PTSD symptoms with the CAPS-5, and they used brain scans like an fMRI, which is a functional MRI, and DTI, which is a different type of specialized MRI, to check for strict changes in brain activity and structure. So what happened? Of the 29 veterans who finished, so not everybody finished the study, but of the 29 that finished, the HBOT group saw a big drop in their PTS symptoms. 68% of participants had a 30% improvement, and 39% of the participants had total remission. In the sham group, only 4% had that same 30% improvement, and there was no members that had the remission of symptoms. The really cool part is that then the brain scans actually backed up this kind of self-reported symptoms, right? So they saw changes in the prefrontal cortex, the hippocampus, and the thalamus, all of which are regions that are associated with PTSD. They also had stronger connections in white matter, which suggests that HBOT might actually repair brain pathways that were damaged by trauma. Research think this happens because HBOT creates a hypoxic paradox. Basically, the high oxygen levels followed by normal air breaks stimulates stem cells, blood vessel growth, and mitochondrial repair, boosting brain healing. So cool. So safety-wise, they found that HBOT was well tolerated. There was no major side effects. So great news for the participants. Well, a few limitations though, right? The study only had 35 participants, only 29 of them finished. It's a really small study. They also only looked at men. They also were only looking at combat-associated PTSD. So there's some crossover here. I don't fully know if we can translate this to other populations, but it's a really great start for this type of therapy. Why does this matter? Well, standard PTSD treatments like therapy or medications really only help 20 to 30% of veterans achieve remission. So a 39% remission rate is pretty awesome. The study suggests that HBOT could be a game-changer treatment for resistant PTSD. But we need bigger, longer studies. The other thing was that they followed up only a few weeks afterwards. So we don't know if those results lasted for a long time. So that brings us to our moment of truth. What do we think? Is hyperbaric oxygen therapy for PTSD proof, backed by real science? Or is it potion, popular, promising, trendy? HBOT's super trendy right now. Is it proven? Honestly, I lean a little bit towards proof, but this is one single study. It's a very small study. So this is our asterisk of the day, right? We said last time we're probably going to have an asterisk on every single one of these. This asterisk is really that the population was small. The population was very specific. It was combat-associated PTSD, right? So I don't know if we can translate that over to kind of the standard PTSD or complex PTSD. We also don't know how it would work in women. We don't have any information there. So a good study overall. I think that this, for me, kind of signals a great start in the research around HBOT, but certainly not definitive by any means. What do you think?
I completely agree. I think it's a fascinating study. I think the results are super cool, especially because these were patients who had failed therapy and medication. So when we're talking about 30% effect, like these are the other 70% of people who are looking for some type of treatment option. And I know in a condition like that, there can be very limited options in terms of what else to try, and everything kind of feels like, a gamble at that point. And so it's nice to have any other potential human clinical trials that show us, hey, maybe there's something here. I think the objective, and like having when we say objective, subjective, like having the brain scans, like the actual imaging and the patient reported results, because a lot of times in mental health, a patient can say, yeah, today I feel better, today I feel worse, and you might just get a single report from that patient on how they're feeling that day or whether they're better or worse. And they didn't do a follow up long term, but at least initially with the brain scans showing all that improvement in multiple different areas and structures, along with the patients reporting that complete remission. I mean, that is pretty powerful to see, not just improvement, but total remission for the participants in the test group. So
yeah. And for me, I think that stands out as well, right? Because I don't know about you, but I see a lot of, when studies are done on mental health, they're strictly on like patient reported experience. That can be really subjective, right? Like really hard to get a good feel if that, what were the conditions that was happening? Like, could we replicate that? Can that be replicated outside of that study conditions? So when you pair something like a functional MRI and actual like changes in brain tissue, like that is the coolest thing ever. And I'm actually even impressed that they even went that far. And I almost wish there was more information about, like, in the study itself, I didn't have any like brain scan images. So like if that had been included in the study, that would have been so cool, because that really makes, it really puts some like oomph behind the proof, right?
Yeah, absolutely. I think I'm always looking for that objective component. And I think subjective is still like having a questionnaire or something still means something to me. But if you can add that additional component, it just strengthens it. Sometimes subjective too, if they look at different time points over several months and they see trends, that makes it a little more reliable. Like if you're looking at mood symptoms or food diaries, if we're looking at nutrition or things like that. But anytime you can add that other hard data point, it's just so much more convincing. I also like to see them. So I like when they include that in the article. But can you talk a little bit about the difference between the sham and, because you said the treatment group went at 100% oxygen, which is like the gold standard for HBOT therapy, right? But we see a lot of different devices, and we see some that are, the soft shell versus a hard shell. What exactly did they do for the sham control? And I think that's another thing that makes this study so interesting, is that certain interventions like this, it can be really hard to try to find something that works as a placebo, because how do you like put someone in a pressurized chamber and then try to replicate that in some other setting?
Yeah, for sure. So this is interesting because we definitely see this like in clinics, right? Like a clinic will advertise, hey, I've got HBOT, you can come and do it. And then you get there and you're like, oh, is this what it is actually? And there's really two different main devices that are kind of on the market right now. There's like the hard shelled HBOT, and it literally looks like a body pod chamber. Like it's like, I don't know if you've ever seen those old time pictures of the iron lung, right? When from
Maybe.
like polio treatment, where like you're literally in this like hard case. Their heads were usually out, but this you would be like fully encapsulated in this hard shell. That is, those chambers they pump in, first of all, 100% oxygen, and they can be pressurized up to typically like 3 atmospheres. We don't usually go all the way up to 3 atmospheres with a human inside of it, but it can go up that high.
The study was 2, correct?
The study was 2 atmospheres. So atmospheres is just like a measure of pressure, right? So those have been studied for like regrowing, like literally regrowing bone tissue, like damaged soft tissue. There's lots of clinical studies on that for those specific things. Soft chambers are like the kind of the next step, I would say, down. And they're a little bit more accessible, right? There's going to be more clinics that have a soft chamber because it's not as an expensive piece of equipment. So more like naturopaths or osteopaths or chiropractors might have these. So
We
these
throw us under the bus like that.
I know, sorry. Even naturopaths, we do our best, you know? So these ones are going to only be able to have ambient air. So that's 21% oxygen. So we go down from 100% in the hard sided to 21% oxygen in the soft sided. And then the soft side can only be, it literally gets like inflated while you sit inside of it. So it can only be blown up to like literally blown up to one, like around 1.3 atmospheres. So it's going to be not as much pressure. And maybe this is a gap in my knowledge is the atmosphere, the pressure actually helps the oxygen like get into the bloodstream, right?
Yep.
So, okay. So like the pressure is important because that oxygen is now getting all the way deep into the tissues and into the bloodstream.
Because the normal air we breathe is not 100% oxygen.
Right.
It has other,
Yeah. And honestly, the normal air we breathe is about 21%, and we're at less than 1 atmosphere, right?
I can't remember.
Yeah.
It's been a little while.
Yeah, please correct us if we're
Is that scuba diving?
yeah, totally. So the soft-sided chambers are really just like a little bit more than like normal room kind of environment. Now, that doesn't mean that they don't have their benefits, but there's just not, it's not like the hard like clinical research. And in this study, they actually used the soft-sided as the sham and the hard-sided as the experimental, right? So that way both study participants they were like getting into a machine, they were getting into like a little container basically, and they just didn't know which one they were getting. Were they getting the pressure and the oxygen, the high oxygen, or were they getting the normal oxygen, kind of normal pressure? It's kind of interesting.
Did they say anything, maybe they didn't, about like, because when you fly in a plane or you go scuba diving, you can tell when you're being pressurized. I have not experienced HBOT in either form because I have an ear disorder. I actually tried to go scuba diving and I think they went about 50 feet down and I went about 10 feet down.
Yeah.
And I had to go back up because my ear would not accommodate it. So I saw an ENT and he said he could do surgery on it, but it's neither here nor there. I wouldn't be able to do it. I was actually kind of disappointed because it seems like such a cool therapy. And I've seen it do such cool things, but I wonder if the participants knew when they were at room air, because was it,
so
or did they get any amount of pressure?
We got
that was above what you would experience at a normal environment, because there would be the difference between the two units, but then there would also be like,
okay, so let's see.
I'm just curious.
Sham protocol. So they got 21% oxygen by mask at 1 atmosphere for 90 minutes. So I have another thing up. 1 atmosphere, so the same. It feels at like a depth of 8 feet. So that's like the bottom of the swimming pool. I think you can actually start. You said about 10 feet.
Yeah, I was feeling it about 10 feet. I'm guesstimating, but yeah.
So at the bottom of the swimming pool of like 8 feet, right? Like you are starting to feel pressure. So so
they were receiving a mask but they were in the unit as well.
They were in the unit, yep, with a mask on.
Okay.
So
it was the same 90 minutes. Okay. Interesting.
Yeah. And the other participants in the hard-sided, they did not have the mask. It was just being pumped right into the chamber.
Okay.
So interesting.
I also wondered, that does make me think too, when they say there's no side effects. And I'm like, these are people with brain trauma and like visible brain trauma on MRIs, right? Because that's the thing about mental health too. Sometimes you don't see imaging results with mental health, but with a patient population like this, they were seeing visible pathology on MRI that could be improved. So I wonder, with side effects, I'm personally somebody who can't use a therapy like that at the moment. And I've heard anecdotally of other side effects with HBOT units. So I was surprised that they reported 0 issue, but they also had dropouts.
They did have
in the treatment group. Did they mention why?
No mention of why.
Okay.
Yeah. So it could have been side effects, right? Like it could have been maybe intolerance to the treatment. It could have also been like 90-minute sessions for 60 days straight. That's a very big commitment.
That's really intense. Yeah.
So that is like a kind of an intense, extreme treatment.
But I have heard actually
to get those results
that's necessary too.
Right.
I have heard for other conditions too, that it is something that needs like high volume, high consistency. It is not a one and done treatment. And
right.
It's interesting. We're on our second article, but we're already seeing that longevity component come into play. Our last
sure.
episode, we talked about ashwagandha for sleep, and it was at least 8 weeks to really get the benefits, the best benefits or more.
Yeah.
And now we're seeing that here too.
2 months.
2 months. And oftentimes, I
8
will
weeks.
say, in
Yeah.
a lot of the treatments I use in practice, it's 2 to 3 months for, the average person to kind of get significant benefits from things. It's interesting that we're already communicating about that in our first couple of studies here. So
Yeah.
great study though.
Yeah. I was excited about it because I think HBOT is kind of, it's a new, fun, trendy, like all you biohackers out there, like this is like a cool thing. And so the fact that we can use it for something like really specific is cool.
Yeah, very cool. Thanks for sharing. And thanks for tuning in to our second article review on fruit or potion. Like, subscribe, comment, let us know what you think. If you've tried these, if you're curious, if you have other research to share, definitely join the conversation.
Great to see you. Thanks for hanging out with us. We'll see you next time.